This video has been developed to provide you with guidance to help ensure a safe reopening of businesses for you and your clients. A full version of the board's rules on infection control can be located in Chapter 15 of the Ohio Administrative Code, located on our website at cos.ohio.gov. Licensees are to wear a facial covering as a safety measure when providing a service. These coverings can be disposable or cloth and must be disposed of or washed properly as required by the CDC. If offering disposable facial coverings to clients, be sure these are only used once and disposed of after. When gloves are worn for infection purposes, they must be changed with each service. Please keep in mind that businesses must require all employees to wear facial coverings, except for one of the following reasons. Facial coverings in the work setting are prohibited by law or regulation. Facial coverings are in violation of documented industry standards. Facial coverings are not advisable for health reasons. Facial coverings are in violation of the business's documented safety policies. Facial coverings are not required when the employee works alone in an assigned work area. There is a functional, practical reason for an employee not to wear a facial covering in the workplace. Hand washing is essential to proper infection control. Board rules require individual licensees to thoroughly wash their hands with soap and water or use a bacterial sanitizer prior to performing services on clients. Doing so will help prevent the spread of contaminants and bacteria. Businesses are encouraged to place a sign on their door stating, "The name of the business is using thorough infection control procedures in order to serve you." In an effort to protect our employees and other clients, if you are exhibiting any symptoms of COVID-19, services will not be provided. This information can be found on the board's website under the COVID-19 tab. You should continue to follow all existing laws and rules set forth by the board. This is also a good time to review Chapter 15 of the Ohio Administrative Code on sanitation. Following the existing guidance on infection control will give you a good foundation to build on. It is required that employees perform a daily symptom assessment and stay at home if symptomatic. You also must maintain accurate appointment and walk-in records, including date and time of service, name of client, and contact information to assist in contact tracing. Remember to launder items that you wear during each workday, such as smocks, aprons, and other work clothes daily. This will help to keep from spreading germs. If providing services such as beard trims, facials, eyebrow waxing, lashes, or other services that require close proximity, you should wear a face covering and eye protection such as goggles or a face shield. Employees must wear facial covering when working unless one of the following exists. Facial coverings in the work setting are prohibited by law or regulation. Facial coverings are in violation of documented industry standards. Facial coverings are not advisable for health reasons. Facial coverings are in violation of the business's documented safety policies. Facial coverings are not required when the employee works alone in an assigned work area. And there is a functional, practical reason for an employee not to wear a facial covering in the workplace. During this time, it is vital to recognize the importance of evaluating how you interact with your clients. We know this industry is one that requires you to be in a close proximity with clients, but you can still take steps to ensure safety measures. It is mandatory that you stagger entry of clients. Only clients will be allowed in the establishment for their service, unless clients must be accompanied by a caregiver. Do not reintroduce items such as magazines, self-service coffee, or candy jars. Clean merchandise before stocking. Schedule appointments with adequate time in between to reduce the number of clients in the establishment. Disinfect reception counter, any retail products, door handles, phones, and writing implements at the beginning of the day and every hour or more based on traffic. Post social distancing signage. Specify hours for at-risk populations, for example, elderly. Place hand sanitizer in high contact locations. Decline services for any client that exhibits signs of illness. Additional changes to help ensure the safety of the licensees and the public should also be considered. Consider a health questionnaire for symptoms at the entry point. Wear eye protection, goggles, face shield when providing services in close proximity to clients. Example, beard trims, facials, and face waxing. Use an appointment system so waiting area is not congested and social distancing can be maintained. Consider having customers wear face coverings at all times. Consider having clients wait in their vehicle or at the entrance of the business with at least 6 feet between. In the physical space of the business, some mandatory examples of requirements are: discontinue client use of product testers, switch to employee-only product handling. Clean merchandise before stocking. Discard magazines and other non-essential items in the waiting area that cannot be disinfected. Discontinue all self-serve refreshments. Establish maximum capacity based on maintaining a 6-foot distance between people. Some recommended examples are: use contactless payments where possible. Consider closing once a week for deep cleaning. Always follow the guidelines in Chapter 15 of the Ohio Administrative Code as they relate to infection control. Clean and disinfect all non-porous implements used in your services, as required by Ohio Administrative Code 4713-15-03. Clean and disinfect chairs and headrests. All items on a nail station must either be new, never used, or cleaned and disinfected. Clean and disinfect all electrical implements used in your services, per Ohio Administrative Code 4713-15-15. All hard surfaces shall be thoroughly cleaned and then disinfected with an appropriate disinfectant before beginning a service. Clean and disinfect station, rolling carts, drawers, and containers used for storage. All hand, foot, nail drying tables cleaned and disinfected after each client. All powder must be dispensed from a shaker or similar container and applied with a single-use disposable item. Store properly disinfected implements in closed containers that have also been disinfected. Ensure that single-use items are new and disposed of after each use. Mark any shared items to ensure disinfection is occurring following each use. No towels should be used more than once without proper laundering. Service rooms. Clean and disinfect all equipment, implements, and tools used. Ensure that all product to be used has not been contaminated by improper removal of product prior to closure. Empty wax pots. Completely clean and disinfect. Refill with new wax. Clean and disinfect service tables. Remember that porous materials cannot be disinfected, and ongoing use of disinfectants on materials covering tables can damage the material. Consider barrier methods on chairs, such as disposable paper drapes or towels that can be laundered after each client. Ensure all single-use items are new and properly disposed of after each use. Ensure that multi-use product containers have adequate single-use applicators available to safely remove product without contaminating remaining product. As a licensee or registration holder, keep in mind that infection control procedures must be followed when draping your client. To protect your client from the spread of germs and disease, always place a neckband or clean cloth between your client's neck and the drape. During this pandemic, you should also use a clean cape, drape, chair cloth for each client. Don't forget the restroom. Clean and disinfect all restroom surfaces, including floors, sinks, and toilet bowls. Consider adding touchless automatic hand sanitizer dispensers. Place a trash container near the door. Remove any products that do not belong in the restroom. Nothing should be stored in the restroom. All cloth towels, robes, and similar items that have to be left in the salon, clean or dirty, prior to the closure, should be washed prior to reopening and after each use. Laundering shall be completed using hot water, and laundered items shall be dried prior to use. All cloth capes should be laundered after each use, and all shampoo and/or non-porous capes should be disinfected after each use. A hamper or receptacle with solid sides shall be used for all soiled towels and linens. Consider storing all clean linens in a closed, covered cabinet until ready to use. After each use, all shampoo bowls, shampoo boards, and any other items used for shampooing shall be cleaned of hair and other debris, and then shall be disinfected using an appropriate disinfectant. Remember to clean and disinfect the handles, hoses, spray nozzles of the shampoo bowl, and don't forget to clean and disinfect all shampoo chairs after each use. Pedicure units, including those that provide circulating whirlpool or vacuum effects, and all removable parts, filters, screens, etc., shall be cleaned and disinfected after each use. Such equipment shall also be flushed and maintained as recommended by its manufacturer. Providing a makeup service is up close and in the client's personal space. Take care to protect both yourself and your client by wearing a face covering and/or face shield or goggles. Ensure the client washes their hands and face prior to service and have hand sanitizer available. Always use clean and disinfected tools for each client. Make sure that you dispose of all single-use items such as beauty sponges, spatulas, cotton pads, etc. Never double dip into liquids, creams, and powders, and always utilize disposable applicators and wands. The Responsible Restart Ohio document, created by the Governor's Work Group for Hair Salons, Day Spas, Nail Salons, barbershops, and tanning facilities, gives mandatory and recommended practices for reopening. Please take the time to review this document on the board's website. The board wishes to thank all members of our industry for complying with the governor's orders to close. We know in doing so you suffered great challenges, both personally and professionally. In reopening, your efforts to abide by all sanitation and infection control standards will allow the industry to stay safe while serving your clients.